least let me ask you a quick question. You probably don't know the answer. I had to look it up. But if I started counting to 1 billion right now, right this moment, in 2023, and I counted, y'all listen to this, you may know the answer. I counted one number a second. 1, 2, 3, 4, 5. And I counted all day and all night. And I counted in the shower. And I counted between bites of a Pop-Tart at breakfast. I keep counting and counting. How long do you think it'd take me to count to 1 billion?
A very long time.
You know how long? Right. I told you were smart. It would take me 32 years. For 1 billion, I'd be 55. It would be 2055. I wouldn't make it. Now, you know how big the federal budget is? That's just 1 billion, folks. The federal budget is $6,000 billion every year. And we can't find 250 million to cap the price of insulin?
What you just watched is exactly why moments like this cut through the noise in Washington. Senator John Kennedy didn't come with polished talking points or soft language. He came with frustration, facts, and plain common sense. And honestly, that's refreshing. This wasn't political theater. This was someone finally saying out loud what millions of Americans living with diabetes already know. The system is broken, and pretending otherwise is insulting. John Kennedy didn't attack patients, doctors, or even innovation. He attacked bureaucracy, excuses, and half measures. And when he called some of these insulin solutions a special kind of stupid, he wasn't being dramatic. He was being accurate. Before we dive deeper, if you care about real accountability in Congress, real policy breakdowns, and real reactions without the spin, subscribe to Congress Lens, hit the like button, and drop a comment below. I'm Audrey, and let's talk about why this moment matters.
Thank you, Senator Kennedy.
Thank you, Madam Chair, and thanks to all of our witnesses. Dr. Kowalski, thank you for giving so much. Have you ever heard the expression yada, yada, yada? What does that mean?
Yada, 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 man?
Yeah.
On and on and on?
Yeah. We've had so much yada, yada, yada about affordable insulin. Not from people like you, but from us. We've been nibbling around the edges for years. Dr. Rogers, thank you for giving so much. Let me ask you a question. Do you have health insurance?
Fortunately, as a government employee, I do have health insurance.
And it's pretty good, isn't it?
It's pretty good, Senator.
Now, who do you think needs affordable insulin? Who do you think needs capping the price of insulin at $30 or so more? You or a homeless or an uninsured person?
Was that to me, Senator, or to
You.
Dr. Kowalski? Well, as you asked the question, I think the person who's less available to afford it would probably benefit more.
Yeah. We got 30 million people who are uninsured in this country. And some of them are diabetic, too. Now, Senator Shaheen and Senator Collins have a great bill. Senator Warnock and I have a bill, too, on insulin. It's called the Affordable Insulin Now Act. And we're working closely with Senator Collins and Senator Shaheen. Our bill would cover everybody. Everybody. Whether you have health insurance or you're uninsured. Because a lot of people become uninsured. Now, I know our health insurance companies, and God bless them. They're trying to work with us to lower the cost of insulin. And they have these programs, they call them patient assistance programs. So if you're uninsured and you can't afford your insulin, they'll work with you. But have you ever tried to apply for one of those programs? Have either of you, any of you? Oh my God. First, the application process. The fine print to apply, there's so much of it. You could hide a dead body in there and nobody'd ever find it. Number two, they send the medicine to your doctor, not to you. So if you got a job or if you don't have a job, you got to go to the expense of driving all the way to your doctor's office, probably have to pay your doctor to get the medication. I mean, that's a special kind of stupid. These free programs only cover one or two forms of insulin. And get this, yeah, they'll give you cheap insulin, maybe free insulin for a month or 3 months or at best a year. And then after a year, you go in one day and instead of $30, it's $567.23. And you go, oh my God, I got to go sell blood plasma to be able to afford it. We need to stop nibbling around the edges. We need to be smart enough to figure this out. And the cost, I think it could be done for $250 million a year. And I'm not talking about taking out a reverse mortgage on Alaska and borrowing more money. I'm talking about finding it in our budget. Elise, let me ask you a quick question. You probably don't know the answer. I had to look it up. But if I started counting to 1 billion right now, right this moment, in 2023, and I counted, y'all listen to this, you may know the answer. I counted one number a second. 1, 2, 3, 4, 5. And I counted all day and all night. And I counted in the shower. And I counted between bites of a Pop-Tart at breakfast. I keep counting and counting. How long do you think it'd take me to count to 1 billion?
A very long time.
You know how long? Right, I told you were smart. It would take me 32 years. For 1 billion, I'd be 55. It would be 2055. I wouldn't make it. Now, you know how big the federal budget is? That's just 1 billion, folks. The federal budget is $6,000 billion every year. And we can't find 250 million to cap the price of insulin? Let's do it right. No more yada, yada, yada.
Thank you.
Now that we've watched the full exchange, let's be very clear about what Senator John Kennedy did here and why it landed so hard. First, John Kennedy exposed the hypocrisy in the room. When Dr. Rogers confirmed having government-provided health insurance, John Kennedy didn't attack him personally. Instead, John Kennedy used that moment to make a critical point. The people designing insulin policy are often the least affected by insulin prices. That disconnect matters. John Kennedy repeatedly brought the conversation back to the uninsured, the 30 million Americans without coverage, many of whom are diabetic. These are not abstract numbers. These are real people choosing between rent, food, and medication. And John Kennedy refused to let the conversation drift back into feel-good language about progress. Then came the patient assistance programs, and this is where John Kennedy was absolutely right to go scorched earth. The application process? Overcomplicated. The fine print? Deliberately confusing. The delivery system? Illogical, sending insulin to doctors instead of directly to patients. The coverage period? Temporary and unreliable. John Kennedy didn't exaggerate when he said you could hide a dead body in the fine print. These programs look good on paper, but they collapse in real life, especially for people who don't have time, transportation, or money to jump through hoops. And when John Kennedy described someone suddenly going from paying $30 to over $500 for insulin overnight, that wasn't rhetoric. That's reality. That's how people end up rationing insulin. That's how people end up hospitalized. That's how people die. The most powerful part of John Kennedy's argument, though, was the budget comparison. John Kennedy broke it down in a way anyone could understand. Counting to 1 billion would take 32 years, and yet Congress casually approves a $6 trillion annual budget. Against that backdrop, asking for $200 to $250 million to cap insulin prices isn't radical. It's responsible. John Kennedy wasn't asking to raise taxes recklessly. John Kennedy wasn't asking to borrow more money. John Kennedy wasn't asking for a blank check. John Kennedy was asking Congress to stop pretending it's impossible to find pocket change in a $6 trillion budget. This is why the moment resonated. John Kennedy didn't rely on ideology. John Kennedy relied on math, logic, and moral clarity. You don't have to agree with John Kennedy on everything to recognize that this argument was grounded, human, and overdue. At the end of the day, John Kennedy said what needed to be said: no more nibbling around the edges, no more yada yada, and no more pretending broken systems are acceptable just because fixing them requires effort. This wasn't just a viral moment. It was a necessary one. Let me know what you think in the comments. Was John Kennedy right to call this out so bluntly? Or do you think Congress still isn't ready to face this reality? This is Audrey, and this is Congress Lens.